name is Oriental S. Asensi, a first-year BSMLS student from the Adventist University of the Philippines. And today we're going to tackle about leiomyoma. So what is leiomyoma? Leiomyoma is also known as myoma. They are smooth, non-cancerous tumors that grows in the uterus and seldom develops in the cervix. Myoma is the upper part of the uterus that develops when it also grows in the cervix, and these are also called as fibroids. Next is the causes of myomas. So causes of myomas varies from different aspects, and one of them is the race. Study shows that fibroids are common among African American women. Another one is age of women, which is at risk of developing fibroids within the range age of 35 to 45. Early menstruation at an early age raises the risk of leiomyoma because of the estrogen level. Next is caffeine and alcohol. They could also affect developing a fibroid according to a 2016 study. The genetic factors, because of genetic alteration, could also cause development of fibroids. Next is obesity and high blood pressure. Also, not maintaining a proper diet can be one of the causes too. Next, let's move on to the signs and symptoms. In rare cases, a feeling of pressure or a lump in the abdomen, fatigue and weakness, difficulties in urinating, anemia, heavy bleeding, and pregnancy complications and infertility. Next is the treatment. Treatment ranges from non-invasive to invasive treatments. First in the invasive treatment is hysterectomy. Hysterectomy is a removal of the uterus and cervix. It is a surgical procedure that removes the uterus through an incision in the lower abdomen. Now let's move on to the non-invasive treatments. First, we have here hormonal contraception. They may be taken orally. And then we have myomectomy. It is a procedure where a thin tube called an endoscope is passed into the uterus through the cervix. The fibroid is shaved and removed while leaving the uterus intact. Fibroids can be reduced, but there is a possibility that it may grow back. And next, we have your endometrial ablation. It is another option if you don't want to have children. Next is we have here non-steroidal agents, an intrauterine device, and an MRI-guided ultrasound surgery. It uses ultrasound waves to shrink fibroids and reduce heavy bleeding. And I have a trivia for you. So in most cases, fibroids will shrink to a much smaller size and no longer cause any symptoms after menopause. For fibroids need the hormone estrogen to grow. After menopause, a woman's estrogen's level decreases dramatically, so which usually reduces the risk of developing fibroids and actually fibroid shrink. So these are the sources or the informations where I got from, and that's it. I hope you've gained knowledge. Thank you for listening.
I'm not who I once was or who I want to be. I'm a sad boy in a sweater.